All right.
Good afternoon. Thank you very much for joining the HART webinar and workshop. The first 30 minutes, we're going to give a brief overview of what the HART profiles are, and then through the rest of the afternoon, we're going to go into a deep dive and talk more about the UMA standard, different profiles, about scopes, and then trusted ways that you could take advantage of the HART profiles as well. So to kick things off, I'm going to start with Nancy Lush from the Lush Group, and we hope you enjoy the afternoon.
Hello. So HART enables patient choice. This section of our presentation provides an overview of HART. Why was HART developed and what problem it solves, what HART is, and the value of HART to healthcare, our physicians, and our patients. HART addresses the following gaps and challenges in healthcare. A patient needs to see a specialist outside of our healthcare system. Too often, there are long delays before that specialist gets access to the patient record. Sometimes a patient wishes to share their health data with a spouse or adult child. A patient may choose to share her health data with a research organization. Or a new provider wants to provide care but does not have access with current diagnosis or treatment history. A patient may have collected meaningful data from her IoT device but has no way to share that with her doctor. A patient with sensitive data needs a way to control fine-grained sharing. Care coverage transitions, as parents travel or relocate seasonally, are not easily accommodated. Patients need the ability to delegate decision-making to an advocate or medical power of attorney. And then we have all of the emergency responder use cases. By solving these challenges, we will empower patients to be more engaged in their own health and have more control and transparency in accessing care. We will empower caregivers to provide better care when patient data is available seamlessly. Together, these will reduce the cost of providing health care while improving patient care. And there are many pain points associated with these gaps. This is the human perspective. There's a lot of frustration out there. Patients repeatedly complete long paper forms from memory. There's a lack of patient access to their own consolidated medical record. Physicians waste time trying to find all of the relevant medical information. And there's negative impact of care. Patients often don't remember and are unable to provide accurate medical data when asked. Physicians are forced to make decisions without complete accurate information, potentially leading to inappropriate treatment. Repeat tests are both costly and not required. So why HART? HART was created to address these challenges and gaps. It enables the patient to safely share her health records with users of her choice in an interoperable way that respects and honors patient security and privacy. It enables patient-directed sharing of the clinical data. So what is HART? HART stands for Health Relationship Trust. It's a set of profiles that enable patients to control how, when, and with whom their clinical data is shared. HART provides a standard to enable patient-directed interoperability implementation through FHIR APIs. HART leverages existing open standards and positions for evolving best practice security standards. HART profiles additional security features supported by OpenID Connect. It gives patients control over how their data is shared, and HART defines the interoperable process to exchange data consistent with those open standards. HART creates a protocol for managing both sharing of permissions and data, and it adheres to the highest levels of security and privacy. In the process, both patients and providers increase trust that the data is authorized and accurate. So where is the industry now? Today, providers can access patient data within their healthcare system. Further, using FHIR, innovative clinical functionality can be integrated with clinical data and made available to providers, all within their healthcare system. The industry is rolling out systems where the patient can safely access their health records from a provider's EMR portal. This will accelerate patient engagement and enable innovations. Back mandated electronic health records. That vision assumed it would enable the sharing of medical records. We realized even then that we could improve care by sharing that patient medical record. During that time, the industry became concerned about patient privacy, and rightly so. But it also created roadblocks to sharing patient data. HART solves that problem while honoring patient privacy and security. I'd like to introduce the terminology of a wide ecosystem. Let's assume our patient Alice goes to a small physical doctor's office that may perhaps be, say, 1 to 5 physicians in that office. Probably all of the caregivers in that office can access Alice's health data, but this is what we call a narrow ecosystem. Now let's assume that Alice uses a large integrated healthcare system with many buildings across many towns and perhaps across states. It may also include several EMR systems. That system may still authenticate against a common authorization server. In this instance, a primary care provider in one building and a specialist in another building both may have access to Alice's health data, but this is still a narrow ecosystem. If Alice needs to see a cancer specialist outside of that integrated healthcare system, that specialist cannot easily access Alice's data. The patients need to exchange clinical data across many healthcare systems. When we have achieved this, we will have a wide ecosystem. So while HART could run in a narrow ecosystem, HART enables the ability to share securely across a wide ecosystem interoperably. HART gives patients control over how their data is shared. Electronic consents per se are out of scope for HART, but most HART implementations rely on electronic consents to define patient sharing wishes. When an authenticated user requests access to the patient's data, the electronic consent is interpreted to determine if the user is authorized per that patient-specified policy. HART enables sharing across multiple parties. The authorization is provided asynchronously, so the patient does not need to be present for access. And the patient makes a decision on who has access to their data, bypassing limitations that may be enterprise constraints. As cybersecurity and patient privacy concerns become spotlighted in current news, patients already have a greater awareness of privacy concerns and the privacy rights and options that are available. While patients do have the right now to decide who sees their data, we do not have a mechanism to ensure that their rights are honored. We expect an increased demand for these new features and need to be positioned to provide these options. So the patient controls who has access to their data, eliminating some of those traditional roadblocks and enabling seamless data exchange. HART works with trusted identity frameworks and evolving industry best practices. It supports true security of delegated access and fosters control for new compliance requirements. HART works in conjunction with best practice security standards. HART also provides more granular management over protected resources. Often, OAuth implementations support single authorization or deny. HART puts emphasis on more granular management. Because patients can define what they're willing to share at a more granular level, they get more control over what data is shared. As an example, a user may request broad access, but permission could be granted for a subset of those requests, not all. The exchange becomes much more dynamic and user-friendly. In this example, a portal may allow users to read a patient's common clinical data set. That same portal may allow users to both read or update a care plan. As an example, the patient may choose to authorize a new specialist to read some subset of her clinical data and update her care plan. Example B demonstrates patient control over sensitive data. In healthcare, sensitive data can be characterized across FHIR resource types. Since sensitive data is cross-cutting against resource type, the HART workgroup introduced special cross-cutting scopes. These provide a mechanism for a patient to control how her sensitive data is exchanged. This is an example of patient granular sharing by sensitivity data as demonstrated by the Consent to Share project. So HART provides more granular management over protected resources. HART leverages existing open standards, adding profiles for important use cases that are not handled interoperably today. FHIR and Smart on FHIR are gaining rapid adoption, and HART further enables that technology for patient-directed exchange. HART uses the well-known OAuth 2 authentication protocol. It enhances use cases by enabling more OpenID Connect features to support more fine-grained authentication claims and more enhanced security requirements. It adds user-managed access to enable patient-directed features in a standardized way. Some of the HART standards are specifically healthcare standards, such as HL7 FHIR and Smart on FHIR, while other standards are industry standards. The healthcare industry benefits by using industry standards and learning from experiences outside of healthcare. These standards are complementary. And together with additional profiles, HART enables the patient to securely share data across healthcare systems. So again, HART leverages existing open standards. HART has addressed difficult use case challenges to enable patient-directed exchange. The more difficult issues have been addressed by HART in the background. So what does this mean for users? The patient interface is easy to use, and the provider interface is easy to use. As this new paradigm is adopted and trust increases, sharing private clinical data will become seamless, ultimately both improving health and reducing the cost of healthcare. In this example, our patient Alice creates a policy to share with Dr. Erica. She selects her sharing preferences and presses share. The patient sharing is just that easy. Provider usage is also easy. The user requesting the patient's clinical data may either receive a notification that data is available, or there may be a link from the EMR via CDS hooks. That user signs in and has access to the clinical data. Again, accessing the data is easy. This particular example provides a view of the data, but FHIR actually provides the discrete data elements. The receiving client could act on discrete data elements just as Smart on FHIR apps currently do, enabling more innovative solutions to further the cause of better care. So HART patient and provider clients are intended to be easy to use. These companies that we know of have already implemented HART, with others considering implementation. For more information, please refer to the implementers draft at this URL. And in closing, I'd like to share several use cases. Alice may access her health records from several of her healthcare providers and store her data in a portal. Her portal enables both sharing consents and HART. Users chosen by the patient would then have dynamic access to her clinical data. If the healthcare system enables HART, the patient data could be available directly in a HART client to any users permissioned by Alice. This scenario might include the ability for Alice to share with her husband, Bob. She doesn't want to give Bob her credentials to access her records. She wants to be notified when Bob has accessed her data, and she wants the ability to revoke that access. In this example from EMR Direct, this is an example of the sharing directives requested by that particular patient. This last example enables our patient Alice to share her device data. This example also provides a mechanism to share control of the device with a third party. While there are some unique elements to this use case, they are not all solved by HART alone. For this example, the device's provenance can be assured so that healthcare providers, payers, and Alice herself are confident that its usage results in correct diagnosis, proper care, and access by the right other parties. So why is HART good for organizations? HART leverages existing standards already in use in the healthcare environment. It empowers the patient to determine who has access to the data and for how long, and it provides transparency to the patient. Widespread implementation of HART will enable the full benefit of FHIR APIs by bringing patient-mediated sharing to a wide ecosystem. This will enable cross-organizational sharing of data to meet the requirements of today's healthcare systems. And the benefits to providers. Having accurate and current medical data is available to clinicians at the point of care, and that will improve care. And having adequate clinical information on that first visit eliminates the delay in treatment and reduces duplicate visits. It reduces the burden on providers to send data manually. Simplification of access to health data by apps and systems enables a range of innovative ways to use medical history for the advantage of both consumers and providers. HART makes all of this possible. By embracing HART for the interoperability transactions that are controlled by patient consent, we simplify life for providers, but also for patients. Patients have control over who has access to the clinical data, but not just who, for how long, and what level of granularity. The patient can be notified who has access to the data and when, and it empowers them to get data where it's needed, when it's needed, eliminating one of our major gaps. It provides the ability to share and consult with a trusted health advocate, and combined, all this leads to improved care at a reduced cost. Our call to action today is to refer to the HART profiles and use cases for more information, and please reach out to the HART work group to learn more and get involved. So you have my contact information that I know will be available at the end of this session. And it is my pleasure to introduce Eve Mailer to present the overview of UMA 2. Eve is the co-chair of HART, the HART work group, and chair of the UMA work group.
Hi, everybody. Thanks so much, Nancy. I want to invite people to submit any questions that they have in the chat, and as we're able, we'll try and answer those questions. So what I want to do now is introduce you a little bit to user-managed access, or UMA, which is now at version 2.0. It's one of the key pieces of standards value add in HART that it's a little bit newer, so you may not be as familiar with it as you are with OAuth. Next slide, please. So many more of you may be familiar with OAuth, with this protocol. OAuth was designed to help us avoid what's known as the password anti-pattern. So it enables constrained delegation of access to applications by Alice. We personified her as Alice. The password in the case of this anti-pattern gives a client application access to a first-party service. So with OAuth, our resource owner, Alice, wants to authorize a client application to make calls at an API. And in the case of OAuth, the client gets access in a secure way, as we see in social sign-in, like you might see in Google and Facebook access. So in the case of OAuth, the service is protected with OAuth, maybe also OpenID Connect, and the client gets a limited scoped access token, not Alice's password to the service. So OAuth actually innovated around consent and also revocation or withdrawal of that consent. And OAuth defines two endpoints, one called authorization and one called token. Next slide, please. So UMA is actually built on top of OAuth 2. It leverages OAuth 2. And to achieve cross-party sharing, UMA adds a new party to the picture, a requesting party, Bob. So UMA basically enables Alice to Bob sharing. Alice can dictate how to share data access with Bob, not just access to applications that she herself uses. So Nancy discussed several healthcare use cases where this is valuable. And one nice property is that Alice doesn't have to be around when Bob wants access. So to accomplish this, the way that the UMA protocol is defined, the client app that Bob uses gets helpful hints about what to do next at each step when he's seeking access. Next slide, please. Another thing that the UMA protocol achieves is this definition of how a wide ecosystem can happen. So Nancy introduced this concept of a wide ecosystem, and UMA makes it possible to actually build this bridge to trust in a more formal way. And in fact, how it does this is that it actually leverages OAuth in yet another way to achieve this, so that Alice is actually sewing together an authorization server, resource server relationship using OAuth. Next slide, please. So what you're actually doing is enabling a variety of resource hosts to be able to work together with a single centralizable authorization server. So the reality is that Alice's health-related data, her health-related devices, and the cloud's that are associated with those health-related devices may live in many places. It's valuable for those resource servers to specialize in what they do, and it may be valuable for a single centralized authorization server to specialize in what it does across many data hosts and to take on the liability for actually doing that task. The fact that you may have a centralizable authorization server can enable Alice herself to get a unified view across all of what's going on, and to be able to express her preferences for sharing access across all of those hosts at one unified place. Next slide, please. So Nancy was discussing going beyond that authorize versus deny paradigm as a user experience. But it's also possible to offer different experiences. For example, next please. A Google Docs-like experience where Alice can hit a share button, as Nancy was showing, well ahead of anyone else seeking access. Or where others try to access Alice's data before she even knows they want it, and then she can consider their requests much later in an access approval interface like actually Google Docs has. Or Uma makes it possible for Alice, as I was just saying, to monitor and manage her resources wherever they live in a central place over time. Additionally, because of the special properties of the protocol and its tokens, she can even withdraw access that she may have already given requesting parties in a finer grained way than you typically see with OAuth today. Next slide, please. So taking a wider view for a moment here. So benefits for service providers of the UMA protocol. First, in an era where strong adaptive authentication is more important than ever, we really should discourage password sharing between people, not just people and apps they themselves use, and implement true secure delegation. And we're seeing passwordless authentication more and more now, so it's really important to start doing this as a paradigm. Second, the best and most scalable way to ensure data subjects' data sharing preferences are implemented is not to guess at what they want, it's to actually implement their expressed wishes on demand. Third, UMA standardizes a way of doing security and access control and consent that is itself API first, which is what organizations prefer these days. And fourth, as Nancy was mentioning, by virtue of setting up loose coupling for the key actors in these scenarios, UMA regularizes their behaviors, and it makes it easier to prove that you conform to privacy laws and regulations. Next slide, please. So, and now taking a wider view of the benefits for patients and consumers. So first, giving people like Alice choice in sharing data beyond just to apps that she herself uses, and as well as giving access to devices, health-related devices, which is just gaining in importance. She can control sharing to healthcare providers, family members, other caregivers, in fact, anybody she may wish. That's becoming increasingly important. Second, the nature of the sharing is really just not reactive. It's not just kind of an opt-in switch. It's able to be empowered and directed, a la consent directives, as Nancy was showing. Again, especially important in healthcare device control. And that's kind of the difference between a smart IoT device and a dumb device is all those things that you can do with it and their data. Third, UMA enables this monitoring and management to be centralizable from consoles and dashboards. And you can see ensconced in the wording of some of the regulations is phraseology like privacy dashboards, and now that can become much more meaningful. And then fourth, this control has many granular dimensions, scopes, sensitive data, as Nancy was mentioning, and the recipients themselves. Next slide, please. So UMA in perhaps a very large nutshell to wrap up this overview section here. So UMA is a standard completed at the Kantara Initiative at version 2. It's based on existing standards. It was recently introduced to the Internet Engineering Task Force, the IETF, where OAuth work is done. It is not just for healthcare, it's also being used in the financial services world. And as so many things are starting to get more horizontalized, I guess you could say, where our worlds are all starting to blend, where there's more open APIs in the world, that's becoming increasingly important as well. It's actually not just a technology, it has business and legal elements as well. It's why we have a BLT sandwich here, business, legal, technical, to account for use cases that we may know well in the healthcare space. For example, like a legal guardian managing health data access for a young child, but then having to give up doing that job over time as that young child grows up. So next slide, please. That concludes our overview. Just want to see any questions on this section here. I see it looks like we've got a chat question that was answered in the chat. If no other questions on that section, we're going to, Debbie, do you just want to say a word?
Well, yes,
yeah.
and there is a couple questions in the Q&A,
Yeah.
Q&A section that you might want to look at.
HIPAA allows sharing of health information for purposes, yes. TPO, treatment, payment, and operations without constraint, yes. So we're really talking about enabling use cases, could be for a number of purposes. And indeed, this is really broadening beyond constrained purposes. It may actually be for any purpose at all directed by a patient or indeed a consumer. I've started to talk to a number of providers and payers about many use cases that can really be directed by them. It could be acquiescing to marketing purposes. It could be for their own purposes and sharing with caregivers in the home, caregivers outside the home, third-party rehab providers who may be under a BAA. It could be that it's sharing with a spouse. One of the use cases that has been especially intriguing has been sharing a bundle of resources. That's OAuth and talk, and we'll explain in a moment, but sharing a bundle of digital resources that may have come from disparate places. So it could have been EHR data, it could have been fitness wearable data, it could have been data from multiple sources, shared with a spouse, and then the organization serving in that authorization server role wants to be sure that the person sharing with a spouse, so this would be somebody in a payer role, wants to be sure that the person who's sharing it with a spouse then has a covered life event. They get divorced from that spouse. And the person has a big incentive to not want to share with the spouse anymore because they're no longer a spouse. And the health insurance payer also wants to know that their systems are clean enough to be able to unshare everything on the person's say-so because of that change in the relationship. And so they want to be able to externalize their authorization and consent logic inside their own systems. And so it's kind of an use case, and it's what I know is an identity relationship management use case, kind of like identity and access management squared challenge use case. And so that's something that I'm seeing quite a bit of when I talk to folks who want to do this kind of delegated sharing use case. So that's one of the ones that's coming up. And it looks like there's a number of Q&A things here. Great. How do you handle surrogate handoff? Okay, so that's where you are looking at like the legal guardian use case, I think. And I'll try and type the answers later so we can have them sort of in the Q&A. But that's a use case where you may have the child growing up and then being competent to consent. And that's another identity relationship management plus UMA and HART use case. And that's one where you would like to manage the relationships, and that's where that BLT sandwich comes in. Public health reporting. Patients may not be able to opt out of required reporting. This is one where I would briefly suggest that foster systems, public health reporting, I'll finish that one. If consent is not the right basis, I'm going to sort of speak in GDPR terms, which I know well. If you look at GDPR, which has 6 legal bases for personal data handling, consent is one of the 6. You should not be using consent as a basis for personal data handling if somebody is not, if they're not able to not consent because you have to handle the personal data. So by analogy, I would say that if you have to handle the health-related personal data, the PHI, and you're not allowed to let them not consent to your handling of it, then consent is the wrong basis to use. So because we're at the bottom of the hour and it's time for us to move into deep dive content, I'm going to switch now and we'll see if we can make sure to answer all the rest of the questions in good time.
Right. And I would say, because the volume of questions, thank you, that
yes,
we may go through and have like a Q&A portion afterwards. When we post the webinar and the slides, we'll go through some of these and post what we can.
Great.
So looks
Awesome.
like you're still up, and I'll just let you keep going.
Yeah, and Debbie, if you can sort of moderate and curate the Q&A if it comes at good times, that will be awesome. Next up is an UMA 2.0 deep dive, and I'll try and keep it very healthcare relevant, and everybody can keep me honest in doing that. So we wanted to ensure that because UMA is a newer part of the heart profiles, that we gave people a good grounding in it. So that's what we're going to do. And I've got probably about 25 minutes of this content, and hopefully we'll have good time for additional questions. So first, I want to do just a little bit of a big picture technical landscape. And so we'll start with what we call the marvelous spiral squared. People who work on UMA are known as humanitarians, and UMA's trust model has been inspired by Fibonacci's marvelous spirals. So this is a square-edged version of that spiral. So UMA is defined in its main spec as an extension grant of OAuth. And that bottom half of this picture is representing the OAuth 2 extension grant that is UMA. And it defines how you do Alice to Bob sharing. As well, there's a subsidiary spec, which we call UMA Federated Authorization, and that standardizes an API for centralizing the interactions of an AS with however many RSs, an authorization server with however many resource servers. Because this ends up involving more than one access token, more than one kind of token of whatever stripe, we started giving them nicknames. And so you can see them here. The access token for the UMA grant spec, for the UMA grant, it's known as a requesting party token because it's the token that enables Bob's access, RPT. The access token that is most closely associated with the federated authorization spec is called the Protection API Access Token, or PAT. And there's a new refresh token-like structure, stands for Persisted Claims Token, is the PCT. More about that later. So now we'll go into, oops, I forgot I had builds here. So now we'll go into just a little bit more detail about the UMA extension grant. What does it add to OAuth? These graphics will be familiar if you joined us for the first 30 minutes. It adds how the requesting party works with the client application. It also ensures the resource owner doesn't have to be around when Bob tries to access the resource. And ultimately, we hope succeeds if he is suitable for access. It also ensures that the resource owner, Alice's wishes, can be expressed and respected. How they're expressed, how Alice's policy for Bob to gain access, doesn't appear on the wire, so it's out of scope. And Nancy was explaining this in terms of electronic consents. She mentioned that they're not really part of HEART. That's true. They're not part of UMA officially either, but they're a big part of what we want to have solved. So they're out of scope, but we still care about them. So the big picture of UMA Federated Authorization, what do they add? What does this add to OAuth? Again, these graphics will be familiar if you joined in the first 30 minutes. This spec standardizes what we call a protection API, as you might have guessed from that PAT token, that obtains between an authorization server and any resource servers that get hooked up to it. So the authorization server presents that protection API that helps to automate resource protection. And that's what makes the AS centralizable. It also enables sharing control at the grain of individual scopes. And it also puts resource servers in control of what counts as being protected by an authorization server. So now let's do a deep dive on the UMA grant spec. And that's going to mean swim lanes. So let's take a look at our first swim lane here. This is all about the UMA grant from a 50,000-foot view here. So the first thing to note is that, well, Alice may not be around. So our authorization server is acting as an agent for what may be an absent resource owner. The very first act of the client is to attempt access to a resource without a token. So that's a little bit different from all the other OAuth grants we may be familiar with. For people who are identity and access management people, that may look to you like classic web access management. Try and hit a resource and normally you get a 404. But in the case of UMA, the resource server is prepared to send back clues about what to do next. So what it does is it provides something that we call a permission ticket, and it also says what authorization server for the client to go to next and attempt to take the next step. We'll say more about permission tickets in a moment. So the next thing that the client is going to attempt to do is what we call claims collection, and there's two options for claims collection. And the point here is to try and have the requesting side meet whatever the policy was for gaining access. So we sort of think of this as claims-based access control, and there's back channel options and front channel options. And we'll go into some detail about that in a moment. So authorization assessment to say, well, did Bob meet policy? Has some guardrails that we'll describe in a bit. The AS needs to consider suitability. Given its agent role, there are some guardrails. And our requesting party token, that's just the access token, as UMA calls it. They can be upgraded, they can be revoked, they can be introspected, and they can be refreshed. Remember, this is just UMA's access token. So I promised you a little bit more information about this permission ticket thingy. It's pretty much how in UMA you start building that bridge of trust that Nancy talked about in HEART. Given that the client and the RS and the AS with respect to the RS are all loosely coupleable, that whole flow needs to be bound together for security. So this is kind of an UMA innovation, this permission ticket thing. It allows robust security and trust, even given the loosely coupled actors. So it also allows flexibility in the way that you test that Bob is who he says he is, so that you can see if Alice said, well, I want to allow Bob to get access to my EHR data or my Fitbit data or whatever it might be. So we allowed that permission ticket string value to be refreshable by the AS if the client keeps coming back and saying, here's more information about Bob, or we'll show you what the flow looks like in a moment. But basically, this whole sort of flow is repeatable and kind of buildable. So it's quite flexible in terms of what it's able to do. So now let me show you the two most kind of common scenarios for how you do this claims collection thing. The most common scenario is known as pushed claims, and it's a back channel scenario. And I'm going to describe it as being for wide-ish ecosystems. And I think you'll find this very familiar if you're an identity and access management kind of person. And And I say wide-ish because it involves some co-location of certain kinds of entities here. So first note that what I've done in this swim lane is I've broken out the authorization server into kind of user interface place and then a couple of different endpoints. We've got a discovery endpoint where you find the OAuth metadata, and then we've got the token endpoint that we know and love. It's a little bit extended in UMA, but it's there. And so the next thing is, now we start our flow. So here we find that the AS is also the place where we find that Bob that's where he goes to log in. And the client that he's using is actually the RP, the relying party in identity terms. So we have an IDP and we've got a relying party. So Bob is gonna go to this IS, that is the AS, the authorization server in UMA terms, that is an IDP to go log in and with his client, and the client's he's gonna get the results of that. He's gonna get, let's call it an ID token in OpenID Connect terms. And then we're gonna go through an UMA dance, and here I'm just providing a little bit more detail for your information. This is what the RS returns once the client does that tokenless resource request. There's a 401, you get a www authenticate with an UMA authentication scheme. And this is how AS discovery looks. You get a header parameter that says AS URI, that's the AS that the client wants to go to. And there's a ticket parameter that actually hands it the permission ticket it needs. Great. Discovery happens. That's just OAuth metadata. And the client then wants to go to the token endpoint to say, hey, where's my access token? And because it's in possession of an ID token that it just got from the AS that is an IDP, it's going to do what UMA calls pushing that token along. Hey, I know who Bob is because I'm a relying party that just got an ID token about Bob. I'm going to push it right along to the AS that's expecting it. The AS is going to say, well, heck, I was the IDP for Bob. I know precisely who this is, so I'm going to go validate this token. I signed it. I'm going to be able to validate it. And we now have success. And Bob is let in. So what we're looking at is something that kind of resembles single sign-on, or maybe the OAuth assertion grant. An ID token is turned in and an UMA requesting party token is granted. And it has the stuff needed. Again, this is at a high level. Okay. Second scenario. This uses a different flow. It uses a front channel flow. And this is for, we're going to call fully wider ecosystems. This is a case where no such assumption can be made about Alice's authorization server being any kind of IDP for Bob. Bob just shows up and he's got a client, and the client is nobody to Alice's authorization server. So I'm skipping detail we've just seen. This time, Bob's client is going to send Bob over to the authorization server saying, I got no help for you. Go have fun at Alice's authorization server. It's going to check you out. And it's going to send Bob to a claims interaction endpoint, which is going to have to have appeared in the authorization server's metadata. Otherwise, the client doesn't know where to send Bob. But assuming it's been declared and it knows where to send him, some interactive claims gathering happens. And that could be a lot of stuff. It could mean that Bob knows how to log in at Alice's authorization server. It could mean that Bob doesn't know how to log in and Alice's authorization server makes him register for an account, makes him fill out a CAPTCHA, makes him get redirected to 3 other places to provide some claims. It could be a lot of things. UMA doesn't specify. There's a lot of flexibility there. One kind of claim that could be collected is, hey, Bob, are you willing to consent to my persisting claims? This is Alice's AS, persisting claims, so that next time you might show up, I can shorthand all of this and say, oh, you've been here before. So I'm calling that a meta claim. What would be really handy is for if Bob were to say yes to that kind of thing, then the AS can issue his client a persisted claims token, or PCT. I told you I would explain what that kind of token is, and now I just did. And I said it was refresh token like, and it kind of is. That way, if those claims still happen to be good and the client shows up with a PCT next time, not so much has to go on around claims gathering. So you might think of this scenario as kind of like an authorization code grant, only it's not for Alice, as in other OAuth experiences, but it's for Bob. And it doesn't strictly require Bob to have a unique identity over at Alice's AS. And you can sort of pump Bob through multiple flows if you need to, and it's buildable, as I described. So hopefully that gives you an idea of how UMA's grant is flexible and yet enables cross-party sharing in a lot of different ways that are applicable to both familiar patterns we know from identity and access management, and also really truly challenging problems in our healthcare space. So now let's take a look at this federated authorization piece. How is that wide ecosystem challenge solved? I'm going to show you an UMA grant picture again, but it's a little bit different this time. It's a new perspective. Just like in the other OAuth grants, the UMA grant says nothing about authorization server, resource server interactions. So now let's wonder for a moment about how those interactions might happen. How does the AS know when to start protecting resources? And how does the resource server know what ticket the AS is associating with the resource server's recommended permissions that the AS should start working on when it gets to authorization assessment? And is there anything at all special about token introspection in this case, in the UMA case? So why don't we standardize an interface at the AS for these jobs? And in fact, that's what's been done. So these graphics on the right will be familiar if you joined in the first 30 minutes. So what the protection API that's been standardized in the federated authorization spec does is standardize 3 endpoints and a security mechanism for them. So the first endpoint standardizes resource registration. That's required for an authorization server to be on the job protecting a resource. The second endpoint is for the resource server to get permission tickets. And the third endpoint is for token introspection and the specialties that it needs if you use token introspection. And we'll go into some detail about each of these. I want to spend a moment here talking about this trust model, this OAuth protection of this API. It's mandatory. So what we've said is this protection API is OAuth protected. That's that sort of embedded additional use of OAuth in UMA. This is really interesting because the resource owner is actually authorizing this AS-RS connection. So however many resource servers Alice is hooking up to what may be a central authorization server, she is owning that connection. And that's very important because she controls it. And if she revokes that connection, it means that she's saying bye-bye to that trust. This is that building bridges to trust, and it's also breaking them down if Alice says so. So let's take a walk through each of these endpoints and how they work. So the resource registration endpoint, it's really a whole API in and of itself. It's kind of a CRUD API. And I'm not going to go too much into the details here, but I just want to note that registering a resource puts it under protection, and the availability to set policies can be done anytime after a resource is actually registered, after creation. And I want to show you here basically some code examples. Oh, deregistering a resource removes it from protection. And so what this means is that a resource server is authoritative for what its resource boundaries are, because, hey, in this case, the HART profiles spell out FHIR resource types. And so we've made the resource server authoritative for what resource types it actually supports. And this is where David will go into much more detail about HART scopes later. And Justin will comment on security properties as well. But so specifically what we're doing here is leveraging the UMA properties of resource registration and marrying them to FHIR. So the way this works is resource registration is what enables a resource server to say, I support these actual features of FHIR. And it works like this. So let's say you want to do a create request as a resource server. You would actually post this kind of request message, and you'd be declaring by sending this metadata over to the authorization server that you intend to use the observation FHIR resource type for this resource, and it supports the read scope, patient/star.read. That's the specific type, a specific scope dictated by our profiles. And you're basically registering that to exist as a resource. And the response comes back, and the authorization server assigns a resource ID, RC1. Having done that, now the other two endpoints leverage the same design of this structure. So the permission endpoint is how the resource server is going to get a permission ticket that it's going to be able to supply to the client. So the resource server is in charge of interpreting that client's initial resource request, or if it ever has gotten an insufficient token message from the AS and it has to go back to the beginning, it'll do the same thing. And the resource server is in charge of figuring out, well, if the client hit a resource without a token, it has to figure out, okay, well, does this mean Alice's resource? And does that mean that Alice's resources are being protected by this particular AS so that it knows which AS to go to with this request, and so on? So the request in this case for a permission ticket looks like this. You can see that this is a familiar kind of request structure now. Resource 1, and it's interpreting what the client tried to do as read. And a permission ticket comes back. The token introspection endpoint, let's say that we've got kind of a stateless model here, and the token doesn't really sort of have anything in it. It's just an opaque string of some kind. So the resource server is in a position to need to go look up what's associated with the token. So UMA needs to enhance the token introspection response object because of this ability to have scopes that could differ per resource. We're bound by, in the case of the HART profiles, we're bound by what HART is attaching, in the way of scopes to the resources. So here we're just adding a permissions claim with resource ID bound scope. So in the request, you're basically just sending the token, and you're getting back this response object. And here you see the permissions object that we've enhanced so that you have the resource ID and the scopes. And there's just the one scope in there. One last bit I'll cover, and then I will have time for a few questions, which I'll take a look at in a moment. So authorization assessment. I said that there are guardrails. What are those guardrails? So, if you look at OAuth, RFC 6749 has this section 3.3, that says the authorization server may fully or partially ignore the scope requested by the client based on the authorization server policy or the resource owner's instructions. That's kind of vague, I guess. UMA gets a bit more specific, and that's because of Alice's and each of her RS's importance in this picture, because that's the way UMA's built. So let's take a look at what the guardrails are. And this is how the authorization server adheres to the RO's wishes in the larger context of all of these RSs that may be attached. So we've got this Venn diagram here that is kind of hinting at the process that the authorization server has to go through once it's gotten all the information assembled about the scopes asked for, and it's got a bunch of policy, and it's got a bunch of environmental context. So one of the things you need to know is that the client can request scopes at the token endpoint, the way you can in other OAuth grants, but it must have pre-registered them with the authorization server for that scope request to work. And that's pretty much a check on client legitimacy. And we don't say, how you have to have pre-registered those scopes. That's, between the client and the AS. The next thing to know is that the authorization server treats the scopes in the intersection between pre-registered and requested scopes as matching any available scope that's associated with a resource in the permission ticket, as we just saw, as the resource server requested them. And that's because clients know nothing about resource boundaries. They just know about scopes, pretty much, as in the documentation that a resource server may have put out about its API. And so we'd look at like FHIR documentation in our case for HART. The permissions associated with the permission ticket can add to the total requested scope. So even in the case of the intersection between A and B, permission ticket can actually add to the list of scopes being considered. And that's because we give weight to the resource server's authority over its own API and resource boundary definition. So the resource server can say, well, I think that the client's trying to do X, Y, Z, so I'm going to add to this. And finally, if authorization assessment results in only a subset of what the client was looking for, it can actually choose to error. And that's just clarifying what the authorization server's authority over such business rules is. And that's because of that kind of like, clarifying that quote that I just gave you from the OAuth standard is. So that concludes the UMA deep dive, and I hope it gave you context about what this means around the HART profile. So I'm going to turn things over to Justin in a moment, but first I want to just check in the interface here about all the questions that probably have now appeared. Let's see. Many EHR FHIR servers are closely coupled with their respective authentication and authorization servers. How would one transition from this model to a centralized authorization server? Great question. This model is looking to, as Nancy was mentioning, solve challenges in wide ecosystems. So it's kind of a new class of challenge, and we don't anticipate that necessarily folks who are happy solving exclusively narrow ecosystem challenges may want immediately to solve challenges in wide ecosystems. But I know of people who are starting to want to solve wide ecosystem challenges as an adjunct to what they already do solve. So I think sometimes of what we saw actually 20 to 15 years ago to 10 years ago in the federated identity space, where we saw, the first challenges of wider ecosystems and identity, of federated identity, where you saw different topologies of identity federation take hold. and it was, incremental in some places and then wider leaps in some other places, like higher education, where you saw what I would refer to as stars of trust, where everybody was an IDP and everybody was an RP, a relying party, all at the same time in higher education. So that's just one observation from me. Maybe others will want to jump in as they get a chance. I'll probably leave that there so as to make the comment a little bit shorter. But we may see sort of some who choose to be sort of simultaneously UMA-enabled HART servers, and some who may just want to be like OAuth-enabled HART servers, for example. So the first claim scenario, here's another question, would be used where the two parties have an existing relationship, as in the case of HIE exchange, whereas the second scenario, so the first one was push and the second one was interactive claims gathering, whereas the second scenario would be useful for handheld apps or other applications that the responding party does not have a relationship with. Yes, exactly so. Well stated. Final question here, how does a healthcare consumer know that they are using UMA? What apps are testing UMA now? So we had 3 HART-enabled implementations, and I believe all of those were UMA implementations as well. Ellen, I will invite others to jump in and comment as we switch over to Justin's presentation. Thanks everybody for your kind attention to this presentation as we switch over.
All right, I think we are ready for the next section. My name is Justin Richard, and I am going to talk about the HART suite of profiles, get into a little bit more technical depth there, as well as kind of situating them in a world with other kinds of profiles that we see in this space today. So first off, it'd be nice if I could actually, there we go. All right. Why have a profile? What is a profile and why are we dealing with them at all? So the thing about a specification, a standard specification, is it's going to give you a lot of options. It's going to say there are certain ways to do things. There's a thing called a door that you can open and close and walk through and whatnot, but it might give you the option of a lot of different doors. And so in some situations, you're going to use one, some you're going to use another, and that's kind of left up to your discretion. And depending on how the specification is written, how tightly it's written, the options that two people pick aren't always necessarily going to be compatible. And this is especially true when you have some fundamental base layer protocols, security protocols like OAuth, OpenID Connect, and UMA, which are designed to solve a very, very, very wide array of security issues and security problems. You can choose different ways to implement them, and they're not always going to fit together. So what a profile does is it comes along and it says, yeah, these other options may exist, but this is the one that we're using. So we are deciding that in this situation, this is the specific set of options that we're actually going to be doing. Now, this works in a couple of different ways. First off, and most commonly, you will see a profile as a conformant subset of the specification, which is to say that by doing everything in a profile, you're still conforming with whatever specification that it is profiling, but it makes a lot of optional things mandatory. It often will remove options that are potentially problematic or don't fit this particular use case, or in cases where you just have to pick one thing or another, it picks one. And the end result is that the options that you choose in your profile make things more compatible, such that if you've got one system running a profile and another system running a profile, they will work together within the constraints and auspices of that profile. And especially important for the space that we're working with in HART is that you can choose options that are more secure. So you set the defaults of all of the options that you choose to be more secure. A lot of security profiles will give you options to do things one way or another depending on how you want to apply and deploy specific security. And this is especially true of protocols like OAuth, But with with things like the heart profiles, we want people to be able to say, like, you do one or the other, and this is exactly how it's going to work. So at the end, you want things to be working together. This is what the profile itself is all about. It's all about making things work together. And that's not to say that if you took two off-the-shelf OAuth systems, they wouldn't work together. They might. But within the scope of this profile and profiles like it, you have a much better chance of things actually connecting at the end of the day, because a lot of the optionality will have been taken away by the profile. Nancy covered this earlier. HEART is an awkward acronym for Health Relationship Trust, and it's a suite of profiles that's hosted in the OpenID Foundation. An interesting historical note is that HEART was one of the first vertical specific profiles from the OpenID Foundation, which is to say that we were looking at how do we apply all of these security profiles to the healthcare space, and with a specific focus on user-centered access of healthcare data APIs. And we built the HEART profiles in a very, at the time, novel way. When we were looking to solve this problem of profiling for the specific vertical, we realized that we needed to profile the underlying security mechanisms, but also adapt them for the healthcare space. But we realized that what we were doing in the base protocols was not necessarily healthcare specific, and that led us to what we called the mechanical profiles. They focus on the underlying security layers to build connectivity between different systems so that you could have a HEART OAuth profile server connect to a HEART OAuth profile client, and it would work whether or not you're actually sending healthcare data. We wanted this to be able to be reused. We, of course, did, however, have to deal with healthcare data. So that's where these semantic profiles come into play. And the semantic profiles are all about how you connect healthcare data, and we focused on the FHIR protocol specifically, the FHIR API specifically, over OAuth and over user-managed access, which we've just been learning about. Now, I'm not going to get into all of the depth and details of the mechanical profile because there's a lot of stuff in there. But what it boils down to is going through and saying, hey, there's a whole bunch of different options that OAuth allows you to do. We're going to say do specific things. So for example, all clients need to have what are called asymmetrical keys. OAuth allows you to have shared secrets in the form of the client secret. This is far and away the most common use of OAuth 2 in the wild. But in the HEART profile, you have to have an asymmetric key and a means of presenting that. HEART also says that your redirect URI needs to be matched exactly, whereas OAuth is a bit more fuzzy about that. We also say which token formats you use and what goes inside those tokens. OAuth allows that to be completely vendor specific. Now, the reason for all of this is that with the HEART profiles, we wanted to make sure that all major technological components of an OAuth ecosystem, the client, the authorization server, and the resource server, are all able to connect to each other in different ways. So for the client connecting to the authorization server, we say that the server has to be discoverable, its keys need to be published, it has to have a registration mechanism, you can expect the URLs to be matched in particular ways, specific grant types and client types are supported. And an interesting thing here is that HEART actually took a step back from the standard OAuth way of looking at the world, in that a client is any software application. And we said that, you know what, people are using this in different ways. You've got web-based applications, in-browser applications, mobile and desktop applications, and clients that are working just sort of direct in bulk access. So this is kind of the health exchange type of scenario where you've got a lot of data going from one space to another that it's not necessarily on behalf of a specific patient or user, but instead on the authority of the exchange. HEART wanted to be able to work with all of these, but we knew that all of these types of clients were going to have different aspects. So what you do within the Heart profile depends on the type of application you have and the type of access that you're using. The client also needs to be able to talk to the resource server, and a lot of this was already covered by a relatively narrow set of specifications in the OAuth world, but we tightened that down even further and said that this is the presentation mechanism that you use, and the token that you get is going to have a specific format. Now that's important here because the resource server needs to be able to understand the token when it comes in, regardless of who wrote the authorization server. We wanted to really enable the wide ecosystem in both the user-managed access and the OAuth use cases by allowing any resource server that is Heart compliant to be plugged into any authorization server that is also Heart compliant. Now, those of you familiar with the underlying technologies may be interested to know that we have specified both a token format as a JSON web token, and we've said that it has to be signed, and we have recommendations on key types and things like that. But we also say that the token itself should not include any personally identifiable information about the person making the request. Also, if you have a self-contained token, it's difficult to know whether or not it's been revoked. So we say you also have to allow the token to be introspected at runtime. We do both of these because that signature and that payload in the JOT itself allows the resource server to say, oh yes, this token comes from an authorization server that I know that I trust. That can be a policy or configuration question. But it also tells me, has it been modified? Has it been expired? So I can do a really quick thing locally without having to talk to anybody else. But introspection gives me both detailed information and real-time information, because if somebody's coming in and asking for very sensitive information, I want to know, is this token really still good, or has it been revoked by somebody since it was issued? This also allows a resource server to talk to multiple authorization servers. Now, this doesn't necessarily have to be the user-driven, bring your own authorization server, fully wide ecosystem scenario. This can just be a resource system that is set up to talk to multiple healthcare providers. There are lots of scenarios where this makes sense. And this allows you to look at the token to see which AS it came from and see whether or not you actually trust that. Now, in OpenID Connect, there are fewer connections because there are fewer moving parts. It's all about getting identity from an identity provider to a relying party. So we say which ID token claims and which signature methods are required to be supported. But we also say everything that you have to do in the OAuth profile also applies here. These things build on top of each other. For UMA, it's much the same. It's much the same picture, because here we're talking again about the technological components talking to each other. Where UMA really changes the picture of OAuth is in the parties, in the people that are involved in this picture. But as far as the software talking to each other, we say, well, okay, you need to be able to present your claims as an ID token from an authorization server and an identity provider. You have to support UMA discovery. Your tokens, all of your tokens need to follow specific formats, and everything else from the OAuth profiles. And on the connection between the resource server and the authorization server, we say you have to support federated authorization. You have to allow this type of runtime connection to be able to look up information about the authorization server and build up your authorization requirements during the transaction. The semantic profiles, again, take a little bit different look, and it's mostly how do you access stuff over a FHIR API. In other words, if I'm a client and I want to get at a specific thing, how do I ask for it? I need to be able to do that consistently across all of these different APIs. Even though they're speaking FHIR, I need to ask for the right OAuth token or the right UMA token to be able to get that stuff. And if I'm a resource server, how do I interpret a scope on a token that comes in? We're going to take a quick look now, and we're going to look a little bit deeper later. A core scope in HART has 3 parts. The first part basically tells you whether you're acting on behalf of a specific individual or you're doing that type of bulk access that we talked about before. The second bit tells you what kind of FHIR resource you're asking about. And we do allow a wildcard that says all resources for the current patient or all resources that I might have access to. And finally, we allow you to say what type of action you're going to take on that resource. So am I going to do read access? Can I upload new information? Can I do both? Can I extend this with something new that isn't covered by this core scope? This is some different type of action. This is where I would put it. We also have scopes for describing confidentiality of information. Now, this is how you ask for information that has been tagged with confidentiality markers. This isn't necessarily saying that you have to tag all information with its confidentiality. But HART is saying that if you have information that you can filter based on this, then you will be able to respond at the resource server when you see a token that says this confidentiality code in it. You'll be able to pull that information that's been appropriately tagged in your response and filter out things that don't match the access that the token has. Same idea with sensitivity, except the sensitivity goes across a whole bunch of different standardized sensitivities for, sociological information, alcohol information, HIV information, all sorts of things like that. When you have information that has been tagged with this type of sensitivity marker, HART allows you to say, when I see a token, an access token that has this scope in it, I am going to either let the data through or not, based on whether I have that on the token and whether I have that in the data itself. So there's a standard set of sensitivity markers. This, of course, can also be extended. And finally, there's the break the glass scope. Now, what this is this tells, this is the way that a client can tell the authorization server and the downstream protected resource that, hey, something is going on. I may not be the resource owner here, but I need access to this now, and I can prove that I have the right to access to this, and we'll clean up the mess later, right? I can't wait for the resource owner to approve this. I need this now, and we'll figure it out later. What this does is this tells the resource server to do additional auditing, additional notification, and it tells the authorization server to do additional vetting on the person that is requesting access, whether you're doing OAuth or UMA, to say this person and this piece of software is allowed to use the break the glass scope. And so by doing that, we have a situation where you can now say, I just need to get in right now with this full wide ecosystem dynamic system, and we can allow the information to flow in this type of situation and be able to track it and sort of pick up the pieces later, because it's better for the data to flow when somebody's life is on the line than it is to necessarily stop it. We're going to take a quick look at some of the other profiles that are tied to both the healthcare vertical and potentially to other verticals. So we're going to first look at the SMART project, which is all about how do we standardize. It was focused on standardizing deployed healthcare applications. So this is a very, what can we do absolutely right now today with the state of the art of what's available in hospitals and doctors' offices and portals today. The target for SMART is largely around application portals and bundled applications. Now that is expanding today, and SMART is moving towards a wider view. But it's really got its start in this notion of how do I launch an application that has been tightly bundled to a patient's healthcare portal. However, the application needn't have been written by or included with, written by the people who wrote the portal or included with the portal itself. It was effectively from a technology and perhaps an acquisition perspective, a third-party application, even though it's been tied tightly into the healthcare system by the healthcare provider. And there was a lot of really great stuff that's come out of the SMART project, including the SMART scope system, that 3-part core scope. That was an idea that we have brought in from the SMART project, in such a way as we have aligned the work that we've been doing in HEART, which is, again, very broadly focused, with what's been going on in SMART, which is very hands-on and feet on the ground. I would not say that we have built on SMART, nor that SMART is built on HEART, but they are two efforts running in parallel with similar long-term goals, and we're seeing a lot of alignment over the years. If we want to take a look at a different industry, in the United Kingdom, the financial industry has been told by the government that banks need to make account information and transfer functionality APIs available to third-party applications. And it has to be done in a standard way across all of the major banks. And what's interesting about this space is that this is a case where the government made a regulation that everybody had to follow by a specific date, and industry had to come up with what the right standard solution is. The Open Banking Group has built their profile on top of OAuth and OpenID Connect, much like we've done with the HEART specifications in the healthcare space. And you see a lot of similar solutions, but also some interesting novelty in this space. Like, for example, registration of intent and transactional-based processes. So we're seeing some innovation in other verticals that will probably potentially be applicable to the healthcare space as well. HEART, as also being one of the first ones in this space, has really paved the way for a lot of this vertical specific profile work. Now, the financial grade API or FAPI working group in the OpenID Foundation is basically doing work that the Open Banking group in the UK is doing, but on a much wider scale, much beyond just banking APIs, but for lots of different financial and high value APIs. This is now the parent specification of Open Banking. In that Open Banking is a profile of FAPI itself. And we're seeing some interesting things come out of this group, including a client-initiated backend authentication, the CEBA platform, and the JOT authorization response method, or JARM. What these do is that these are additional pieces of functionality that were invented to solve specific use cases in the financial space that are seeing applicability in a wider world. And finally, the iGov specification is another OpenID Foundation profile, but this is for government use. So government to citizen, government to government. It has a similar approach to HEART in that there's a split between the technical profiles and whatnot. And in fact, the core technical profiles, the original text of the iGov specifications was taken directly from the HEART working group and built on for this use case. What that allowed them to do is focus on the specifics of the government use case, which, as you might imagine, include things like citizen identity numbers, social security numbers here in the United States. There are national identity numbers in other systems. How do we communicate and track those in a way that is privacy preserving? How do we communicate information about proofing documents? If somebody is talking to the government, we want to know that it is actually the appropriate citizen. Did they show up with a passport at a local office and somebody said, yeah, that's them, this is their account? How did that happen? And there's some good work being done in the iGov world and related spaces on this technology called vectors of trust, which allows you to communicate things, including how was the person proofed, how did they authenticate, how was this carried across the network, from one system to another in a way that is standardized and relatively simple compared to previous attempts, at least, to use and parse. At the end of the day, it's not really a direct one-on-one comparison between all of these different efforts. They're all focusing on things from a different perspective and in a slightly different way. But they're all kind of poking at similar aspects. This is far from a comprehensive table to compare all of these things. But I wanted to point out that there are a couple of interesting areas of commonality and difference. For example, everybody across the board here says that you have to use an exact match URI. That's something that was in the HART profiles, and just about every new profile we're seeing in the OAuth world says, yeah, you really need to do that, including current best practices from the OAuth working group in the IETF. A lot of these groups are getting rid of shared secrets. A lot of them are doing things with dynamic registration, but again, not everybody is. Only a couple of them are working with wide ecosystems. Most are focusing on narrow ecosystems. And we're looking at where the commonalities between solving problems in those two different world spaces really comes into play. And with that, I've got a few minutes for questions. There's my contact information. And let's see. As such, does this mean that patient applications can provide consumers with very granular level data sharing capabilities, and health information exchanges need to be able to ensure this granularity is preserved across the network? That is an excellent question. So the granularity of the data, in my view, is, and I would encourage the other panelists to chime in as well. In my view, the granularity of the data is something that is, it should be preserved, but sort of the ground truth is that data is going to be transformed and incorporated and amalgamated as it travels through different systems. People are going to store things in a little bit different way. They're going to combine records so that you have your full medical history in one, in one data store. And then when that goes out somewhere else, you might have something, something different happening. So yes, ideally, you would be able to have all of that information in a very granular fashion, but it's entirely possible and even probable, I would say, that some of that granularity is going to get lost in practice when data gets moved around the network. All right. Any other questions, or do any of the other panelists want to jump in on the data granularity question?
No, that's fine. So maybe that might leave a few minutes for, we were so tight in the schedule, maybe that'll leave a few minutes for questions for the other two presenters. So thank you so much, Justin. Oh. David, are you ready to queue it up?
Oh, can you share some of the real life examples of HART implementation? Eve, I'll give you this one.
Real life examples of HART implementation. Actually, Nancy shared 3 examples, and I believe all of them are UMA as well. So we have EMR Direct and, I'm trying to think of Well, Lush Group has one. I'm trying to
HIE one. I also know
HIE one.
in the Move Health Data Forward Challenge, there was
Yeah.
Docket and Live and Live Well. So, and I would also say that these apps have actually helped. We went through a second round of updating the profiles, and a lot of that was due to the testing. So we welcome more actual interop testing of this work.
All right. Thank you all. I think we are ready for the next presenter.
Okay, that would be me. So it's difficult to follow these presentations. Obviously, a lot of work went into all of them. All very good. My name's David Staggs. I've got 15 minutes to talk to you about scopes. So, and how the scopes support the secure, interoperable, distributed authorization paradigm we've been talking about using FHIR and a RESTful approach. So let's get into it. And if it gets too technical, don't leave, because Dr. Moss comes after me and he's got a great presentation too. So let's see. All right. Oh, this is going to be tricky. Okay, so scopes are defined as individual pieces of authority, as we've learned before. First off, you've got to have an agreement on how attributes are going to be securely exchanged, their meaning, and how to use those attributes, how they will be used in the access control decision. We've covered a lot. FHIR gives you the common vocabulary. Scopes are the way you exchange them. And HART gives us the rules that increase data security and privacy, as Justin described. So here's our general description of scopes. They are compound strings. You see it there. Scope equals a permission / resource .access. And when we're talking about patient, remember, patient doesn't mean the patient. It means a patient, a single patient versus bulk access. So let me give you a picture of the core scope. So here's a representation describing the scope statement in HART. The resources can be any FHIR resource. For example, scope could be patient / appointment .read, and that would give you, that would ask for read access to a specific patient's scheduled appointments. So patient, remember, is not the ID of the patient, it's just a string, meaning it's specific to a patient. The scope statement can also include confidentiality codes. They are included in a request by a client and could be authorized by the authorization server, and when allowed, can return information of a higher heightened sensitivity. So here's an example of confidentiality codes. They're a type of security label, a HL7, Health Level 7 security label, and they describe the overall content of the information bundle. So you can find that on the HL7 FHIR pages, and HL7 Healthcare Privacy and Security Classification System. So they describe the information associated, and they're like the high watermark. So you get a bundle in, and you have to have the authorization of the highest level of confidentiality in order for you to be able to look at it. So one of the things you can do in adding confidentiality codes, as Justin mentioned, is that you can add on confidentiality /R for restricted. There's normal, restricted, and very restricted into your scope statement. And if it comes through in the request having been approved by the authorization server, it'll say this request has permission to access data labeled as restricted. So the data could include information like HIV status, things like that. So we also talked about sensitivity labels. They provide finer control over access to protected information. So they describe a resource perceived as undesirable to share without additional controls, like data that might cause a stigma or financial harm to the patient. So alcohol, drug abuse, HIV status, psychiatric care, these are all security. There's big vocabulary of security labels, and heart support has labels they support in their standard. So in this case, you have, for example, scope patient / star, that Justin said, that's everything. And then two sensitivity labels, you've got ETH and PSY. And this statement is telling us give full access to this patient's data, including substance abuse information and psychiatric information. So there's also one, purpose of use, we've discussed. So purpose of use indicates a reason or context for performing operations on information. So access decisions can be made on why the request is being made. For example, emergency, marketing. In general, the purpose of use gives you the context, like marketing operations, payment, you can see them there, right? So, and treatment. I think someone mentioned treatment. So purpose of use treatment categories can include subcategories like clinical trials, coordination of care, emergency, break the glass, emergency room treatment. Those are all part of the vocabulary. So here's the big picture Eve showed us. So as Eve discussed earlier, this illustrates which entities are involved in the exchange of scopes using UMA, User Managed Access 2.0. You can find more details for the elements in the upper box. That's in the Federated Authorization for User Managed Access, UMA 2.0. And the bottom box is governed by the UMA grant for OAuth 2.0. So you can take a look at those. But the diagram shows the tokens required and describes the resource server and authorization server. Like Eve told us, the authorization server is a server that protects on the resource owner's behalf resources hosted over at the resource server. So the resources, you can get a description in the HART profile for FHIR UMA2 resources. So the resource owner works with the authorization server to configure grant rules, which will be used when a request is made by a client, so the user doesn't have to be present. And the authorization server uses scopes and the rules, grant rules, in the process of determining access tokens, issuing access tokens requested by clients. You can look at the scopes in the HART profile for FHIR OAuth 2.0 scopes document. So Eve used swim lanes. I will use a picture. So I'll try to focus in a little bit on scopes. This shows the creation and issuance of a protection API access token, the PAT. And the PAT gives the specific resource server the authority to interact with a specific authorization server. So you got to have that in order to interact with the authorization server, and that also identifies who the resource owner is. So the resource owner can also communicate separately to set up their access policies, and that will be used in deciding, along with the organizational policies, whether the requested acts can be allowed. So now that we have the PAT, we're going to register the resource. So there are several endpoints on the authorization server, as I've tried to illustrate. Registration of the protected resource. The resource server defines the boundaries of the protected resource and the scopes available to that resource. Then it registers the protected resource with the PAT, using the PAT in the header, at the authorization server's resource registration endpoint, the little green thing. This creates a resource description at the authorization server and includes the scopes that can be applied to that resource, the actions on the FHIR resources, right? So the authorization server then returns a handle to the resource description back to the registered resource so they can maintain it, update it, change it, delete it. So let's move on to the red font. This is the UMA grant. The green was things pulled out of the UMA Federated Authorization. So now let's take a look at the authorization server has a resource description and the resource server has a handle to it. So they're both on the same page when access requests come in from a client. So here's a client, right, down here. So if a client makes a request without a valid resource party token, RPT, then it triggers this resource server to calculate the required permissions for the requested object and then send the permissions over to the resources, it sends the permission for the resources in a permission object that goes to the authorization server. The authorization server responds with, as Eve described, the permission ticket, right? And that's a handle to the requested permissions. So now the resource server has that, and it can push the ticket and the authorization server location over to the client. So if the client successfully receives the permission ticket, and it can now use it at the authorization token endpoint here, right? And to request the requesting party token, the RPT that it needed. And that's specific to the protected resource and the resource server. So the client uses their unique identifier and credentials. As you remember, Justin said there's a lot of signing going on to prove the authorization, to prove to the authorization server that its requesting party has the clearance to access protected resources over at the resource server. And you can do that by pushing claims or setting up authorization server and the requesting party directly, right? So after you've got that, you've got all the scopes, and the authorization server can take a look at the resource description and decide whether you should have access. So let's just say we fail. So if the requesting party is authorized only for a subset of the scopes, the authorization server, as Eve said, could return an error, or could return an RPT containing a subset of the authorized scopes for the resources associated with permission ticket. So in our example, let's say the first attempt failed, but the client was pre-registered with the authority to submit another scope called the break the glass, the BTG, at the authorization server's token endpoint. So the client could ask, and this is a common scenario, they could ask the requesting party, for example, a clinician, if they want to resubmit with break the glass. So it's important to note you've got to be registered to be able to do that. But in this case, we're going to resubmit it. So client uses their client ID specific to them, the permission ticket specific to this interaction, and adds the scope break the glass. So in the healthcare domain, break the glass does not result in overriding access controls. It's used during the authorization server's authorization assessment. BTG is just another factor combined with the security policy, organizational policy, and the patient's grant rules to determine authorization. So if the resource description and the organizational and resource owner policies permit access to the requested resource for this particular requesting party, the RPT may be returned with all the requested scopes. So the client can now use that, now request access to the protected resource on behalf of the requesting party using the RPT specific to that resource, resource server, and authorization server. Pretty good, right? So here, the client requests the protected resource with the client ID and requested party token. The RPT is an opaque handle, so as described, the resource server has to send that RPT to the authorization system and for the introspection endpoint, and the authorization server returns an object holding an array of objects, each having a resource ID, and authorized scopes. So the scopes within the sets of scopes registered for each of the resources, not just any scopes, but the subset. So the resource server uses that information to determine whether it should permit the action requested by the client. And there is some autonomy which is needed because the resource server has its own organizational policy and legal requirements. For example, it would share differently between, let's say it's VA versus DoD or VA versus non-DoD. So there's some autonomy that's given there. So I've got 15 seconds left. So I'll just say there are a couple of slides to describe these permissions that we've been talking about. You might want to go take a look in the link. I also walk through what it looks like, and there's also a description of how the authorization assessment's done. So I appreciate you spending time with me today, and here's my contact information if you need it, and I think I'm done. Anyone want to take it from me?
Sir Louis, it's your turn. There we go. Thank you.
Okay, thank you, David. And thank you, everybody, with the patience to stay till the end here. I'm Louis Maas. I'm CTO of EMR Direct. One thing that's clear from listening to all the previous parts of this webinar is that there are a lot of actors in the FHIR ecosystem. And they all need to talk to each other, including the authorization server, the resource server, the client application, and the end user. And as we've seen, HART can add requesting parties, grantors, possibly even identity providers. So it gets very complicated. What I'd like to do today to finish off the webinar is to take a higher level view of the ecosystem and talk about a number of tools that can be used to establish trust between these actors to make the ecosystem scale more effectively. These tools are based on straightforward extensions to OAuth and OpenID and are intended to work seamlessly with FHIR and with a number of security and sharing frameworks, including HART. More importantly, I'd like to talk about how these tools allow all this to take place dynamically and in a frictionless manner so that we can break existing bottlenecks, but not compromise security or trust. So let's start with the registration of client applications. Today, app registration is essentially a manual process, and this is only going to get worse in an exponential manner as the number of apps and servers grow. So clearly, automation is needed here. I'd like to begin by discussing dynamic client registration, or DCR, as I will refer to it, as a starting point to address this need. So what is dynamic client registration? Essentially, this is a standardized API to automate the client registration process, where the client application can provide the necessary metadata about itself needed to make the OAuth and FHIR workflows work. What we're shooting for ultimately is leveraging DCR and some extensions to it so that client apps that the end users are choosing can register and connect to the endpoints that are needed on the fly. Much like a user of the World Wide Web today can pick their own browser when connecting to a website and can freely switch between the browsers without really noticing any difference as far as access to the data on the other end. So here's an example of how a dynamic client registration might appear to the user, because the OAuth server that supports this will know that the client registered dynamically. And we believe transparency in this is important, so that the server will display to the user what information it knows about the app and include the dynamic nature of that registration if that is the case, so that the user is well informed as to what's going on. Basic dynamic client registration is a fairly open process, as on the example I showed on the previous slide. So the question is, how can this be expanded to establish a trusted network of client apps. So one approach that's being actively worked on in this area is application endorsements and certifications. These essentially allow third parties to verify or endorse applications and provide what is a reusable vetting that can be used across the trusted network based on the requirements of a given community. So this approach, where third parties can vet information about the app developer or the app itself, can increase confidence by the relying parties as to which app they're actually dealing with and who has evaluated it. And this information can be transmitted directly by the client application to the server at the time of the connection. And how we're looking at doing this and the standards that are being approached for this use signed JOS, JSON Web Tokens, and the X509 certificates, which together bring in all the benefits of the digital signatures to integrity and authenticity of these certifications and endorsements. Additionally, these certifications and endorsements can be tied directly to a client's private keys, such as those that Justin mentioned in the HART profiles, so that this can be tightly bound to a particular app identity. And that's one way to do that, and there are a few others we also have explored. Importantly, this concept of the trusted application registration also works for headless applications, or the so-called back-end applications, where a user isn't present, such as apps that might use the OAuth client credentials grants, for those of you who are familiar with that. And this has been an area where dynamic client registration has historically been problematic, but bringing the trusted aspect into it can really address that need as well. So what do you get after you've added endorsements and certifications to this environment? Well, there's several powerful things. You no longer have to rely on self-assertion submitted by the app developer or operator in the basic open dynamic client registration. But instead, you have access to the verified information about the app and the developer. And this could include verification from one or more third parties. So the app is not limited to just a single endorsement or certification. It can include all the relevant information for the use case that it is trying to execute. So this does, in fact, become a reusable identity for the application across the ecosystem. And the app developer, thus, only needs to register once for each certification or endorsement that it wants, rather than having to go and register everywhere every time, even if the likelihood of connecting to a particular endpoint is low. So, for example, an application could use a certification across a whole network of different health systems and API providers, different vendors that have chosen to recognize collectively a particular certifier and endorsement or endorser, thus forming a trust community. And this obviously is much more desirable than having that app developer register separately with each of those health systems and each of those technology vendors, which can, as everyone in this space knows, be a very time-consuming process. So in the framework that's being developed here, I'll also add that the vendors and health systems, this isn't a one-size-fits-all solution. The individual participants that hold the data can opt in or opt out of different endorsers or certifiers based on their own requirements and their own use cases. And this lets the servers, the data holders, enable a number of advanced features on the server side based on the information in these certifications and endorsements. For example, the server could enable read-write access to a certified app that has certain credentials, as opposed to just basic read access for an uncertified app. You could add access to certain sensitive or restricted data to an app that holds certain endorsements about privacy, for example, whereas that might not be made accessible to a generic app. And there are any number of client scope step-ups or access step-ups that you could envision for different settings based on this kind of information. Importantly, I'd say the certifications and endorsements can also be used to increase the confidence of the end users participating in the ecosystem, where they can see information about their app, who has verified information about the app, and what people or organizations or endorsers have said the app is appropriate to use for. And just on a related note before I move on, this same trust framework of the identity and characteristics of the participants can also be used to increase confidence that a participant is connecting to the correct FHIR endpoint. And, you know, with the growing deployment of multi-tenant type situations, conventional SSL web certificates just may not be good enough, and this type of extra level of verification of the entity that controls the data, the actual data holder, and not necessarily the server operator, can be very important. So let's put this all together here. What we have is a number of gears holding different parts of the ecosystem tools I've been describing, and showing how these might tie into the OAuth sign-in page, for example. So you can see in the bottom, information about the app has now been enhanced in a way that it also displays separately verified information to the app user. This is in the middle gear here. I mentioned directories, and there was a question about directories earlier. So let me just briefly comment on that. There are a few directory initiatives underway for cataloging FHIR servers, to be sure. But I'll point out that the Trusted Server Identity Framework I mentioned a minute or two ago, this provides a natural opportunity to aggregate verified endpoint information into a community directory that can also more effectively scale the network. And as the HART folks know, once you know where the endpoint is, you can determine its capabilities, including support for HART or other advanced features. So I would basically talk about the two bottom gears. I'm going to move on to the top gear about users here and talk briefly about trusted identity and trusted identity networks, essentially reusable end user credentials. So in HART and other data sharing models, we have delegation from one user to another user of access. And what we want is for that to work beyond the user space that has local credentials on the OAuth server that's managing this. So this becomes an issue of federated identities, if you will. But beyond just the basic outsourcing of identity, authentication of identities to OpenID Connect servers, we still have the same scalability issues that we've seen in the client app to FHIR server space of managing these trusted network of identity providers to allow for a dynamic environment where more than one identity provider might be available, depending again on the use case and requirements of the community. So one approach to this built on OpenID Connect and uses the same trusted network concepts I've been discussing for apps and servers to allow an OAuth server to dynamically register to use an OpenID Connect identity server if they're part of the same trusted network. So that can happen even if the servers have not previously interacted. So in this case, the OAuth server registers as a client with the identity provider in the same way that the client app would register with the OAuth server. Because the OAuth server is in the middle and acts as both a server to the app and a client to the identity provider, this is known as tiered OAuth. And there's a link on here that for those of you who get the slides, you can follow for some more information on this. So in the HART setting, tiered OAuth can allow those user-managed access grants to cross organizational and server boundaries in a dynamic way. In other words, we're no longer restricted to using the identities that are registered directly with the local OAuth server, and the users no longer need to go and obtain separate credentials for each OAuth server or FHIR endpoint in the network. So two scaling issues have been addressed there. And as an added benefit, the data holders can get relevant user information about the end users directly from the identity provider rather than relying on the client app to act as a proxy for this data. And they can use this information to make access decisions or to assist in access decisions. Since the communication is between trusted parties, the OAuth server, and the identity provider, the framework enables access to a richer set of user metadata for these purposes, metadata that could even be used for identity resolution if necessary. So plugging this into our world of gears, we see an additional element brought in with this idea of the trusted third-party servers, OAuth servers, and identity providers. And all of these tools, as illustrated, will work harmoniously to scale trust across the various actors in the ecosystem: the resource server, the OAuth server, the client app, the grantor, the requesting party, the identity provider. They can all talk to each other dynamically in a trusted way, using essentially straightforward extensions to OAuth and OpenID Connect. And they can communicate even if they have never previously interacted without having to go through an extensive pre-registration process. So I'd like to summarize a little bit here, as there are some common patterns of trust that are enabled by this framework, regardless of the participants. And I've tried to collapse this down to 3 repeating concepts. Starting from the left, the registration of the participants, whoever those are, the end user, the client, apps, the servers themselves, can be automated. And this eliminates the multifaceted exponential problem of manual registration, and it allows for vetting of participants to the level appropriate for each community and each use case. Moving to the middle, at the time that a connection is established, participants can dynamically register with the corresponding server so that they can be reliably identified. And finally, on the right, the data holders can dynamically get information about the other participants to make informed policy and access decisions prior to responding. So where do we go from here? Well, first, work is underway on an implementation guide for trusted dynamic client registration, which makes use of most of the tools I've discussed. Second, for anyone who's interested in joining the group of implementers already testing these tools in a cross-vendor, cross-platform environment, I'd invite you to the next HL7 Fire Connectathon in Montreal on May 4th and 5th. There's a link on the slide here with more information. Third, if you're interested in collaborating on the actual specifications and profiles that enable these workflows, you can find the current drafts of the Unified Data Access Profiles at the UDAP site shown here. And finally, the trust communities themselves can start evaluating what policies and criteria, if any, they need for the use cases they want to support, so that they can implement these items to scale their ecosystems effectively. Thank you. That's the end of my part of this talk, and I appreciate everyone who stayed till the end. And thank you to Debbie and the ONC folks for sponsoring this event. I don't see any open questions here, but if anybody has any, I guess we are pretty much at the end of the allotted time. But any of the panelists that want to jump in, I'm done.
Great. And I just want to say a heartfelt thanks to all the participants today for this very long webinar. And thank you so much for staying and listening to everybody that hung in there. And have a great day.
Thank you.